what this foolishness is gonna be all about today.
You know what? Today is.
Our favorite Mr. Oh, I see. I got lit. Miss Darlaina Rose, all the way out of Atlanta, Georgia. The mic is yours, honey.
Thank you so much. I ain't gonna beat you up too bad today. Today is really just gonna be surprisingly very educational because it was this is a subject that we've talked about before. Hold on. There we go. This is a subject that we've discussed before, but it has come up again, so much so that Dr. McCullough put it on his on the website again. And normally when he puts stuff up is usually because something has come up again, and at an alarming rate. And what it is a really hidden epidemic that is fueling cancer and heart disease. And is nothing that we would even think of. And if you are somebody that is suffering from cancer or heart disease, this is something that you should look at for yourself and for your loved ones. And a lot of times, it goes back to medicine, traditional medicine, not looking for the root causes of these diseases. And when I read it, I'm like, what? So Dr. McCullough had this conversation with this board certified cardiologist named Dr. Levy. And he was sharing his insights of this area of health, namely your mouth, your oral health. And we talked about that before. And what he said was oral infections are a stealth contributor to chronic diseases such as breast cancer and heart disease. Like when you think about heart disease and when you think about breast cancer, you're not thinking about your mouth. You're not thinking about that it could potentially be coming from there. And he was Dr. Levy was so intrigued by it. He wanted to do more research, and he found a Dr. Huggins, who wrote a book called The Rapid Virus Recovery, in which he detailed how to handle this stealth issue of oral health. And Dr. Levy also wrote a book on oral health that you can download. It's called Hidden Epidemic: Silent Oral Infections Cause Most Heart Attacks and Breast Cancer. It's on MedFox's website. MedFox Publishing is on their website. So he talks about the importance of getting this imaging called 3D cone imaging, at three cone beam imaging. I never heard of it before I did this research. And he said, when you get this type of imaging, you'll be able to see infections that are in the mouth, and you'll see the heat signatures coming from the mouth, from the inflammation of the mouth, and it will be pointing. You'll see the inflammation going straight from the mouth to the heart, or straight from the mouth to the breast, to wherever the cancer is or wherever the heart disease is. And I'm just like, who even knew that this type of thing even existed? And so this hidden epidemic, which is the perfect title for this, it's an issue that's flying below the radar for a lot of health professionals. They're not even looking at it. So, and it said, despite the fact that 95% of the population or more have some sort of infection in their mouth that's influencing your health in a negative way. And so Dr. Levy said his initial journey was seeing what Dr. Huggins was doing, in addition to the use of vitamin C and taking out mercury fillings. He also focused on another Dr. Weston Price work, which showed the root canals are chronically infected. It's not like this root canal is okay and that root canal might be okay, but every single one, 100% of the time, root canals are infected and affecting your health. Dr. Higgins' work was later documented with a Dr. Boyd out of the University of Kentucky. They had over 5,000 root canal teeth extracted by dentists from around the country submitted to them. And they did all this sophisticated testing, and they found extremely potent toxins and really bad bacteria in every single one of those $5,000 teeth. It brought out the point that the infected teeth are like a nuclear bomb of oxidative stress. And this oxidative stress is the lion's share of what causes chronic infection and illness. So Levy co-wrote a book about these findings with another doctor, Dr. Robert Kulaz, called The Toxic Tooth. And about 4 or 5 years ago, Dr. Levy convinced his friend that she needed to extract 3 root canal teeth that she had. And then she had the 3D cone beam examination. And this examination not only showed that tooth, those 3 teeth, but a 4th tooth that they didn't even see that was infected and abscessed, that wasn't shown on the regular dental X-ray. So an ordinary Panorex X-ray can find up to 40% of dental abscesses, but with this 3D cone beam, you can find 20% more. So that's 60% added to what you're going to do. It's 3-dimensional. They rotate it around your head. It kind of slices up your head, and it literally looks at every part of your head. And so there's a lot of information in there other than your teeth, but it's the only way that they can detect small, otherwise undetectable abscess teeth. And so it's so important, because once a tooth is abscessed, no matter how small, the tooth is dead. I didn't know that. The tooth is dead, and it's accumulating infection that can disseminate through the rest of your body. And then you wonder why you have all these chronic things going on, and you don't know where it's coming from, and it's literally coming from your mouth. And so once it's like that, it's important to know that this 3D examination is the single most important thing that can be done for a person who has heart disease, who had a heart attack, or a breast cancer patient. In addition to, there's many other diseases, but those 2 are the biggest ones: heart disease and breast cancer. If you know somebody that's suffering from that, they should absolutely have this 3-dimensional test to determine if the disease is being radiated from their mouth. That's deep. That's deep. And if it's not done or has never been done, they're missing more than 90% of the time the cause that the person has the condition in the first place. These stealth oral infections are so common. And when Dr. Levy's friend needed those root canal teeth, pulled out, we don't realize that root canals are done I think my research says about 45,000 times a day. That's the go-to for most dental procedures when it comes to, they tell you things like let us save the tooth, and then they charge you $4 million to save the tooth, versus coming up with a way to remove the tooth and either put a implant or a bridge in your mouth. Because what happens is when a root canal is done, um, the inside of the tooth is drilled out, the pulp of the tooth. And when the pulp of the tooth is drilled out, that's the blood supply, that's everything the tooth needs to be alive. And once that has been removed, the tooth is now dead. Root canal is the only thing that is done in medicine where they allow a dead thing to remain in the body. So when you think about it, a dead tooth in your mouth, what do dead things bring but bacteria, but infection? And the odd part about a lot of times with these types of infection is there's no pain, there's no nothing to indicate that something is wrong. You know, this one lady who had all of these abscesses going on, 4 of them, that was only revealed by this 3D exam. She never had any pain at all, and most people will not have pain. So he said, in speaking with dentists, Dr. Levy also realized that most dentists fail to realize that horribly abscessed teeth can be clinically silent. You can chew on them, they feel fine, they don't ache, they don't hurt. And everybody thinks an infected tooth will trigger like pain. Chronically abscessed teeth have no discomfort at all 95% of the time. And so one of the dentists that he talked to said he got the 3D cone beam exam, and he said his patients had abscesses all over the place. And so if your dentist don't even have it, your dentist is not even prepared to even tell you. So we have to find the dentist that has 3D, 3 David, cone, CONE, like ice cream cone, and beam, like a beam of light, BEAM, so that you can get this exam and find out if you have that, especially if you are somebody who is suffering from chronic illnesses that you're dealing with, whether that is heart disease, high blood pressure, diabetes, lupus, MS. These are all diseases that come from inflammation in the body. And if the inflammation in the body has not been identified, you could very well have abscessed teeth that you don't know about that's causing it. And once those teeth are removed, guess what happens to the disease? It dissipates. It leaves. And so, you know, when you have these infected dead teeth, they need to come out of your body. And then you can do some other form of restoration, something along the lines of a bridge or implant. If especially if you are concerned about your health or your doctor is concerned about your health, those teeth cannot stay inside the body. They must come out, along with any root canals and any mercury-filled teeth. And even when you are thinking about getting mercury fillings out, they need to be taken out a certain way, because mercury is a very deadly substance. Mercury, if you took, you know how, like a regular like thermometer, you remember the thermometer Kemp we used to have in the classroom? And it would sit on the side and you would learn the temperature. That little bit of mercury, that's the thermometer that tells you how the temperature of the room, the temperature outside, that little bit, if you dropped it into a body of water, it will not only kill all of the wildlife, but it will be messed up for a long time. It will, the wildlife will be messed up, the water will be messed up. They will have to like deem it hazardous, and you wouldn't be able to go in it for just that little bit of mercury. And so here we are now walking around with mercury fillings in your mouth. Those mercury fillings are affecting your life in the cellular, your body at a cellular level. So when you have the conventional approach, when you have an abscess, you know what happens? Your mouth is achy or not, and then your face starts to swell. You wake up and your face is all swollen. You like, why is my face swollen? It's your tooth. And so you go to the doctor. They tell you you have an abscess, and they may the typical intervention is the root canal. And again, the root canal is where they shave off the top of the tooth, go inside the tooth with little rotor rooter things, and they actually pull and scrape out the inner pulp of the tooth. And again, the pulp is the nerve connective vascular center of the tooth. It has all the nerves, all the blood supply. And the reason somebody goes to the dentist with this type of tooth is because it hurts. So primarily the root canal procedure is a pain relief procedure only. It is not an infection eradication procedure. Because what they do is once they do all that, what do? They give you pain pills and they give you antibiotics. But the infection now becomes chronic. So once you finish the antibiotics for the 7 days, you may bring the infection down, the swelling will go down. And what happens then is the infection now becomes chronic and it's just in your body because the tooth has all these little teeny holes in it. It has these valleys and canals in it. You know, we are fearfully and wonderfully made, right? So if you pulled all those tubes and canals out, they would be miles long.
Recording in progress.
They would be miles long in each tooth. So miles and miles of nooks and crannies where infection can sit. And because there's no blood supply, there's no connective tissue to help it clean, it just festers there. And the more it festers there, it causes autoimmune disease. It causes lupus. It causes multiple sclerosis. It causes all of these things because all of these diseases, the root cause of it is inflammation in the body. And that is
what about your dad? Well, okay, here's a question she had just asked. She says, what about an implant?
Implants are a viable way to replace a tooth. Just have to get a professional to do it. They not and,
So
and
that's metal.
it's just depend. But it's not mercury. It's
Okay.
not. It's most of the time they're made out of titanium. The same thing that like knee replacements and hip replacement materials made out of. So it's a safe material. You just have to have a good person that knows how to do it because sometimes what happens is placement is painful and you know it's a healing process. So because the implant has to go into the jaw, and so it definitely is a more permanent replacement. But there's also partial dentures and bridges that you can get. Like it's a tooth, but it connects to the two teeth on the side of it. When you get a bridge, the bridge sometimes can damage the other teeth that it connects to. So you just have to look at you know what it is and determine what's going to be best for you. And so definitely no root canals. No root canals and mercury fillings should absolutely be removed because the problem is once the pulp of the tooth is infected, the tooth is dead. And they say if you feel pain, it can't be dead, but you're not feeling pain from the core of the tooth. You're feeling pain from the connective tissue around the tooth, from the infection that goes down into the root of the tooth. And just because there's pain doesn't rule out the tooth is technically dead. And so with root canal, you kind of taxidermy the tooth. You know how Bugs Bunny would see all of the stuffed animals, and he say taxidermy. And so yeah, so you can't. So, it really just puts the tooth in a state of technical preservation, but not infection elimination. And so in both the hidden epidemic and the toxic tooth, they go through all of this literature that speaks to what a root canal tooth is. And there's a ton of literature that shows how toxic teeth and how closely they correlate with coronary artery disease, with cancers everywhere else throughout the body. And it's really a nasty scenario to have infected teeth to stay in your body. And listen, I know how much this stuff costs. I got one root canal, and I remember having to get on a payment plan because it was over $1,000 for one tooth. And it's bad for you. And if you have them, you should be looking for a holistic alternative dentist to have them removed, because not only do you have to have the dead tooth removed, but you also have to have the periodontal ligament removed because it's going to be infected too. So if you have root canals in your mouth, I am sorry to be the bearer of this news, but they must come out. They must come out for the long term of your health, especially if you're somebody that's dealing with something chronic, something inflammatory. They have got to come out. And if they're not bothering you now, trust me, they will. My root canal tooth is 30 years old. And it started to bother me maybe a year ago.
Yep, I remember.
And I did all of the stuff that I knew to do to avoid going to the dentist and all this kind of stuff. And you know what waiting got for me? Underneath the tooth, my jaw is hollowed out. It has like a cavity there. And so now I got to deal with that on top of removing the root canal. And mine is 30 years old. So, and what the dentist will tell you is that, oh, they were never meant to be a permanent thing, a permanent, way of handling things. And so they don't tell you that when they take your money. They don't tell you that when, it's, we making you spend all this money. And the other thing is when you chew on a root canal, every time you chew on something that has some abscess or root tip under it, you actually push the pathogens and toxins into the draining venous and lymphatic circulation of your mouth, effectively just like giving yourself an intravenous push with a syringe to disseminate through your body of more infection and problems. And so in this same interview, he talked about periodontitis and its connection to disease. So he found out that Dr. Levy found out that he had periodontitis, and it was which can exacerbate or trigger just about any chronic disease. There is a cause and effect to the relationship with most diseases in the body. There's always a cause. But what happens is in traditional medicine, they don't look for the cause. They just start to treat the symptoms. So typically, periodontitis, you get that before the abscess. So once the gum is inflamed and gets bad enough, it permits the oral pathogens to reach the apex of the tooth. That's when the abscess begins to form. And a chronically abscessed tooth is known as a chronic apical peritonitis tooth. And if you have it, you probably don't have good normal gums either. So one comes with the other. So if once you have inflammation of the gums and the pathogens seep into the lymph every time you chew, it makes its way to the breast tissue. It seeps into your vein system, which leads to left atrium or left ventricle of the heart. And that can cause low pressure, and then it gets pushed out of the heart in high pressure into your bloodstream. And so that means it travels through your venous system without any problem, suddenly go through the body, can cause this coronary artery disease. It says 25% of the cardiac output gets the lion's share of the pathogens that are first exposed in high pressures. So you pushing it straight out. When the data was done, 100%, 100% of the plaque, 100% of the plaque that was scraped from a person's vein, 100% of it had the colonized periodontal pathogen, which means these people with coronary artery disease, with plaque around their heart, when that is examined, they found 100% of the time that it came from the person's mouth. I'm like, this is madness.
Yeah. And I had a question for you too. Miss Laverne.
I don't even have a question. Good morning. I have a comment. I don't know. I don't know if what you're talking about is what my husband is, but he's a diabetic. So if he got the result of him being a diabetic, he was constantly doing it. And it got to the point he didn't want to get all his teeth removed. Like they literally told him, "You're going to have to get all your teeth removed," because they had got that bad. And we had to like convince him it was killing him. 2 years ago, they told me I needed a root. No, I went on a cruise and I had a toothache. And when I went to the doctor, they was like, "We'll give you a root canal," but they gave me like this temporary feeling until I get the root canal. They gave me the root canal to say you need to get the cramp. I let them pull the tooth. Because at that point, I'm like, "You're gonna cost me more money. You know this is something that can kill me, but you're going to tell me this is a cosmetic type of treatment." And it's not.
It's not.
You need to be trying to save my life. So I was like, just take the whole tooth out. I don't want it. And then now it's like, "Oh, we need to give you another crown for another tooth." No, when it's time, it's going to go. That's to you by. Because y'all not going to keep on temporarily treating me and charging me all this money. And then knowing that this stuff is detrimental to my life, not my health, but my life.
Yes. And I'm gonna give you some things that you can do in the interim to hold it back, to help to clear anything that's in your mouth. Because I'm not gonna give you the problem and not give you a way to combat it. So just know, I'm beasting out here in these streets. I'm gonna give you what you need. Okay? Yeah, you ain't gotta do that. You ain't gotta do that. So when they did these coronary artery plaques and everything, they found that all of it came from the mouth. And there's another doctor who did this study on 38 chronic coronary artery disease patients, and he found in them 38 out of 38 patients it came from their mouth. And this Dr. Pessi in Finland, he did a study, and he immediately did angiograms on his acute heart attack patients and found that those with this pre-existing narrowing, that they ended up with this platelet clot and all of that all came from this periodontal pathogen. So your heart patients, people who have heart problems, have them to check their mouths. This doctor went on to say that acute heart attack patients, when they analyzed them, they all had periodontal pathogens and up to 1,600% higher concentration than the surrounding blood. So this stuff is causing stuff that nobody even knows. And that is why they're calling it the hidden epidemic that don't nobody know about. And the fact that if you don't even know it and you're chewing and pushing it down, and every time you chew, you pressing it down into your bloodstream, into your blood system, into your lymphatic system. And if you're not doing things to keep your body clear of pathogens, and you just going about your life, you eating dead food, not live food, you're not juicing, you're not taking vitamins, your body don't have nothing to fight with it, fight against this chronic infection stuff. So because your body has nothing to fight, that is why the inflammation comes, and that is why the chronic illness comes, like the heart disease and the diabetes and all of that. I'm just amazed that with all of this stuff, that none of these doctors are even checking for it. Researchers have shown that this peritonitis can even change the microbiome in your stomach, because as you chew, these pathogens are pushed out and then swallowed. And once they're in your gut, it can disrupt the microbiome in your gut and cause this leaky gut syndrome. And really irritate any other pre-existing diseases that you have. So in the book, Hidden Epidemic, he lists diseases that are associated with peritonitis, that starts with the heart diseases and the cancers, especially breast cancer. But again, it can be asymptomatic. You won't have no symptoms. So you won't even be, saying to your doctor, well, it's my tooth has been bothering me. No, you're just going to have a heart attack, and then they're going to treat you for the heart attack, and they're never going to look in your mouth. They said abscess teeth that are asymptomatic have a 5-fold greater chance of heart attack in the general population. And, I'm never as amazed as I was to hear this stuff. He even talks about if a person has asthma, peritonitis can have an effect on asthma patients. And so the chronic conditions that are known to be linked to your mouth are lupus, other autoimmune diseases, Crohn's disease, multiple sclerosis, maternal hypertension, chronic kidney disease, erectile dysfunction, inflammatory bowel disease, ulcerative colitis, preeclampsia, Alzheimer's disease,